Hi, my name is Kathy Ellermeier and I'm the Director of Health Services. The number one priority in our LPS community is the health and safety of our students, staff, and of course our LPS families. A great deal of thoughtful preparation from many stakeholders has taken place to create a plan that will safely welcome our students and staff back into the building. Please keep in mind that as information continues to develop from public health officials, our plan may also need to be adapted. Thank you for your patience and flexibility as we navigate the school year together. Let's talk about health and guidelines and safety for students and staff. Students and staff who are feeling sick must stay home. All parents must self-assess their children for COVID-19 symptoms daily. Staff must self-assess for COVID-19 symptoms daily. Staff and students will stay home if they have a fever of 100 degrees or greater. All members of our LPS family will follow these guidelines to screen for the below symptoms of COVID-19 and must stay home if ill. This includes if any of the following symptoms are present, you will stay home. Fever or chills, cough, sore throat, shortness of breath or difficulty breathing, nausea or vomiting, diarrhea, fatigue, headache, muscle or body aches, congestion or runny nose, or a new loss of taste or smell. Next, we will talk about exposure to COVID-19. If an individual has recently had close contact with a person with COVID-19, they need to stay home and monitor their health for 14 days after their last exposure. Families should notify their child's principal. If you've had direct exposure, meaning you've been less than 6 feet away for over 15 minutes with an individual who has tested positive for COVID-19, you will quarantine for 14 days. You must complete the entire 14 days regardless of a negative test. If you've had a positive COVID test, you must meet all of the following conditions to return to school or work. You must stay at home for at least 10 days since symptoms first appeared and at least 24 hours with no fever without the use of fever-reducing medication, and all symptoms have improved. All of these conditions must be met for return to school or work. When taking care of students in our health rooms, our school nurses will follow all of the recommended health guidelines when a child is sent to the health room with COVID-19 symptoms. The following is a list of extra precautions we have in place for the health room. Frequent hand washing and the use of a hand sanitizer or gloves will occur. Visitors will wash their hands upon entering and exiting the health room. Masks will be worn by our nurse, students, and staff. Proper personal protective equipment will be worn based on the individual's health needs. Cots, chairs, and other surfaces will be cleaned and disinfected between staff and student visits and throughout the day as needed. Custodial staff will clean and disinfect as part of their regular cleaning routine. Students showing symptoms associated with COVID-19 will be separated from well students in our health rooms and be sent home per recommended guidelines and professional school nursing judgment. Each health room has been equipped with a portable HEPA filtration system for an extra protective measure. I would also like to address students being sent to the nurse. To avoid overcrowding in school nurses' offices and to prevent potential exposure to infectious disease such as COVID-19 in the school nurse's office, minor health items such as the following will be initially handled in the classroom: chapped lips, dry itchy skin, localized bug bites, students needing bathroom supervision, minor headaches that go away with hydration or rest, non-persistent nausea, minor cuts, and a bruise or bump that does not occur at school. As a general reminder, all students and staff must wear a mask upon entering the building. Signage will be visible throughout the schools to remind students the direction they are to walk, sit, and for social distancing purposes. That is to maintain at least a 6-foot distance from others as much as feasible and possible. Thank you for linking arms together and following these important health precautions as we head into the school year. The health of our LPS community is a high priority for success and student learning. Thank you.